Hey everyone, my name is Tom Baremore. I'm going to do a review of the cardiac and blood modules. So, what I did is I went through the study guide for the final exam and I picked out a few of the questions that were related to these modules and I kind of put them all in one place. So, hopefully, this is helpful to study with going towards your final exam. So, the things I'll discuss are the components of blood, viscosity of blood, things that affect blood flow. Uh, Blood types, the microscopic anatomy of the cardiac muscle, the anatomy of the heart in general, and the cardiac conduction system and EKGs. So there are four main components of blood. There is plasma, red blood cells, white blood cells, and platelets. Um, if you were to put them in a centrifuge, spin them real fast, and separate out each component, you would see that plasma, which is the watery substance of blood, is approximately 55% of total blood. Erythrocytes, or red blood cells, are approximately 45% of total blood. And then the leukocytes, or white blood cells, make up less than 1% of total blood. We remember just a quick overview. Red blood cells, they have hemoglobin pigments within them, and the hemoglobin binds to oxygen. It helps carries oxygen to all of our tissues in the body to maintain oxygenation throughout the body. And your white blood cells, there are multiple different types, but they are part of your immune system. They help identify and destroy pathogens and diseased tissue and cells. And the difference between leukocytes and erythrocytes are that leukocytes, or white blood cells, actually still have a nucleus as well as organelles. While if you remember, a erythrocyte during its maturation process, it actually loses its nucleus and organelles and to make room for more hemoglobins. So, blood viscosity, what is it? So, viscosity refers to like the thickness or the stickiness of blood. And a few things can affect this, right? We don't want our blood to be super thick. We want it to be somewhat, uh, thin. And if you are too dehydrated, there's not enough fluid in the body, your blood will become thicker. If your body begins to overproduce red blood cells, those red blood cells add to the viscosity of blood, and so more presence in your blood would actually cause your blood to become thicker or more viscous, as well as any sort of like agglutination of your blood cells. When they clump together, that can cause an increases viscosity as well. And so then we'll talk about blood flow, some things that affect blood flow, viscosity, right? We just talked about that being like the thickness. Thicker or stickier blood or higher viscous blood will move slower through our vessels. The pressure that's being exerted against them, or the resistance from the vessels themselves, meaning if you have an elevated blood pressure, your blood vessels are constricting more, and that will cause more pressure, and the blood flows slower against pressure. The radius of a blood vessel, um, if a blood vessel is larger and has a larger radius, blood will flow quicker and smoother through that vessel. The smaller the radius, there is a decrease in blood flow. And then the length of the vessel. The longer the vessel, the slower blood will flow through the vessel. You'll see a decrease in blood flow in a longer vessel. So blood types. This one can be really confusing. So I wanted to put this chart on here so that we can kind of have something to reference visually. But before we do that, I want to just talk about what is a blood type, right? So the blood type that you have, every blood cell will have an antigen. Well, not everyone, because you could have O, which would have negative, but none. But if you are A positive, you have an A antigen presenting, and then your B, your body would produce B antibodies. So that way, if you were to get blood that wasn't type A, it would attack it, right? So when we're talking about A, B, and O, A refers to only A antigens being present. B is only B antigens being present, and O is neither being present. And then how do we get positive and negative? That comes from the Rh factor antigen being present. If there is one present, you are positive. If there isn't one present, you are negative. So if you look at the chart here, you can see that the universal donor would be O negative, right? Because it doesn't have any of the antigens presenting. Therefore, the body, when you send it, if you were to transfuse blood into another person that was O negative, there would be nothing to attack. And then, so on the flip side of that, the AB positive is the universal recipient because they have all the antigens present, and so therefore their body does not have antibodies that attack any of them. This could be kind of confusing, so I hope this chart is helpful. It helped me. If you have any questions further about this, I'm happy to try to answer them in the comments, but I like the visualization of this chart. It made it a lot easier for me to understand. So then the microscopic anatomy of a cardiac muscle. So they're typically described as striated branch cells, similar to the striations are similar to like skeletal muscle, right? And if you look on this, I wish I could have found a better picture, but if you look on this picture of the cardiac tissue, you can see the horizontal lines, small lines that are going through the branches. Those are the striations. And then you can see the vertical lines that are kind of perpendicular to that, that happen every so often that are black. They're labeled on here too as well. Those are the intercalated discs. And so the role of gap junctions on in cardiac tissue is that it basically allows for quicker conduction between cells. And then the role of the desmosomes, they help anchor the cells as well as allowing them to stretch, right? Because they anchor neighboring cells together, allowing them to stretch together. So then we'll talk about the basic anatomy of the heart, right? So before I discuss blood flow, we'll just discuss the basic components of the heart. You have two ventricles, two atriums, one of each on the right, one of each on the left. And we know that blood returns to the body through the venous system. So if you look at this picture, you can see the superior and inferior vena cava. Blood flow returns from the body through the superior and inferior vena cava into the right atrium, and then through the right atrium, it goes through the tricuspid valve to the right ventricle. When the right ventricle contracts, it pushes blood through the right semilunar valve, which then goes into the pulmonary trunk or the pulmonary artery. That is the only artery in the body that carries deoxygenated blood. And from there, it goes to the lungs where the gas exchange occurs and returns with oxygenated blood. It returns via the pulmonary vein, which is the only vein in the body that carries oxygenated blood. Pulmonary vein drops the blood into the left atrium, which then contracts and pushes blood through the mitral valve or the bicuspid valve into the left ventricle. And then when the left ventricle contracts, it pushes blood through the left semilunar valve into the aorta. And the aorta is the largest artery in our body that branches into other arteries, perfusing the tissues with oxygen. So then talking about diastolic phase versus systolic phase. The systolic phase is the pressure exerted against the blood vessel walls during ventricle contraction. And then the diastolic phase would be the pressure exerted at rest. So finally, I'll talk about cardiac conduction system and EKGs. So when you're talking about the conduction of electrical impulses through the heart, they start at the SA node, which is above the atriums. The SA node causes an electrical impulse that will contract the atriums, then goes to the AV node, which is considered the gatekeeper because there is a slight pause at this point before the conduction is then sent to the ventricles via the bundle of His, which is then separates into a right and left bundle branch. And then the bundle branches then segment further into the Purkinje fibers. And so the bundle branches and Purkinje fibers will help contract the ventricles. And then last, we'll look at this EKG, this PQRST segment here, and just kind of discuss what each piece means. So the P wave is atrial contraction or atrial depolarization. And then you have the QRS segment, which is the ventricle depolarization. You will not see the atrial repolarization because it is hidden under the QRS complex. And then after the QRS complex, you have a T wave, which is representative of the ventricle repolarization. So I hope this is helpful. I wish everyone the best of luck. Thanks for taking the time to listen. Anyone has questions, please feel free to comment underneath the video. Thank you and good luck.